Oral candidiasis or oral thrush is an infection of the mouth by yeast, and it mainly affects the very young, the very old, or those whose immunity is impaired, and it occurs more frequently in HIV/AIDS patients, the malnourished, diabetics, patients on long-term antibiotics and corticosteroids, and those with poor oral hygiene. The cause is Candida albicans or Moniliae. The symptoms are white patches in the mouth, burning sensation in the mouth, difficulty in swallowing. Breastfed babies may refuse to suck, and also sore mouth. The signs are well-defined white or cream-colored pustules and patches in the mouth. Investigations: buccal mucosal scraping for fungal elements, FBS retro screen. The main treatment objectives are to eradicate infection, to identify and treat any underlying condition. Non-pharmacological treatment: poor oral hygiene and toileting. Pharmacological treatment: for treatment of uncomplicated oral candidiasis, first-line treatment to give nystatin suspension oral. In adults, 100,000 units 6 hourly after food for 14 days. In children, 100,000 units 6 hourly after each feed for at least 10 days. And make sure it is spread well in the mouth. Second-line treatment, you give iconazole oral gel. In adults and children, 2.5 milliliters made on the oral mucosa twice daily for 7 to 10 days. For immunocompromised patients with oral candidiasis, give fluconazole oral in adults 50 to 100 milligrams daily for 7 to 14 days. In children 12 to 18 years, give 50 to 100 milligrams daily for 7 to 14 days. And 14 days to 12 years, you give 3 to 6 milligrams per kilogram on the first day, and then 3 milligrams per kilogram with a maximum of 100 milligrams daily for 14 days. For 7 to 14 days, as you give 3 to 6 milligrams per kilogram on the first day, and then 3 milligrams per kilogram every 48 hours for 14 days. Less than 7 days, you give 3 to 6 milligrams per kilogram on the first day, and then 3 milligrams per kilogram every 72 hours for 14 days. So referral criteria: a referral patient not responding to a treatment, or if there is a presence of an underlying illness, for example diabetes mellitus, immunosuppression, among others, to an appropriate specialist.